Hello friends, I'm Dr. Jeev Ram. Today I will discuss the pelvic inflammatory disease and treatment. Overview: pelvic inflammatory disease is an infection of the female reproductive organs. It most often occurs when sexually transmitted bacteria spread from your vagina to your uterus, fallopian tubes, or ovaries. Signs and symptoms of pelvic inflammatory disease can be subtle or mild. Some women don't experience any signs or symptoms. As a result, you might not realize you have it until you have trouble getting pregnant or you develop chronic pelvic pain. Symptoms: signs and symptoms of pelvic inflammatory disease might be mild and difficult to recognize. Some women don't have any signs or symptoms. When signs and symptoms of pelvic inflammatory disease are present, they most often include pain ranging from mild to severe in your lower abdomen and pelvis, abnormal or heavy vaginal discharge that may have an unpleasant odor, abnormal uterine bleeding, especially during or after intercourse or between menstrual cycle, pain during intercourse, fever sometimes with chills, painful, frequent or difficult urination. When to see a doctor: see your doctor or seek urgent medical care if you experience severe pain, low in your abdomen, nausea and vomiting with an inability to keep anything down, fever with a temperature higher than 101 Fahrenheit, foul vaginal discharge. Causes: many types of bacteria can cause pelvic inflammatory disease, but gonorrhea or chlamydia infections are the most common cause. These bacteria are usually acquired during unprotected sex. Risk factors: a number of risk factors might increase your risk of pelvic inflammatory disease, including being a sexually active woman younger than 25 years old, having multiple sexual partners, being in a sexual relationship with a person who has more than one sex partner, having sex without a condom, douching regularly, which upsets the balance of good versus harmful bacteria in the vagina and might mask symptoms, having a history of pelvic inflammatory disease or a sexually transmitted infection. Complications: untreated pelvic inflammatory disease might cause scar tissue and pockets of infected fluid, abscesses to develop in the reproductive tract. These can cause permanent damage to the reproductive organs. Complications from the damage might include ectopic pregnancy, infertility, chronic pelvic pain, tubo-ovarian abscess. Prevention: to reduce your risk of pelvic inflammatory disease, practice safe sex. Talk to your doctor about contraception. Get tested. Request that your partner be tested. Don't douche. Clinical treatment of pelvic inflammatory disease. Recommended parenteral regimens: cefotatin 2 gram IV every 12 hours plus doxycycline 100 mg orally or IV every 12 hours, or cefoxetine 2 gram IV every 6 hours plus doxycycline 100 mg orally or IV every 12 hours, or clindamycin 900 mg IV every 8 hours plus gentamicin loading dose IV or IM 2 mg per kg followed by a maintenance dose 1.5 mg per kg every 8 hours. Single daily dosing 3 to 5 mg per kg can be substituted. Alternative parenteral regimen: ampicillin sulbactam 3 gram IV every 6 hours plus doxycycline 100 mg orally or IV every 12 hours. Recommended intramuscular or oral regimens: ceftriaxone 250 mg IM in a single dose plus doxycycline 100 mg orally twice a day for 14 days with or without metronidazole 500 mg orally twice a day for 14 days. Cefoxitin 2 gram IM in a single dose, and probenecid 1 gram orally administered concurrently in a single dose, plus doxycycline 100 mg orally twice a day for 14 days with or without metronidazole 500 mg orally twice a day for 14 days. Or other parenteral third generation cephalosporins, ceftriaxone or cefotaxime, plus doxycycline 100 mg orally twice a day for 14 days with or without metronidazole 500 mg orally twice a day for 14 days.